The public, including first responders from several departments around the state, spoke today on a bill regarding reimbursement for certain EMS calls. Keenan Mills has the story from Augusta.
A bill brought before the Committee on Health and Human Services Wednesday would require insurance carriers and MaineCare to reimburse ambulance services for 3 situations. One is community paramedicine, a program within EMS departments that take in referrals from local hospitals to check on patients to avoid future hospital visits. For Waterville, it's funded through grants.
And right now, the hard part is we just have no sustainability. So we know that on July 1st, if we don't get some type of grant funding, the program will again close.
In early 2025, the temporary cutting of federal funding for the program threatened the end of it. And while it just began in early 2024, authorities say there is a heavy reliance for Waterville and surrounding communities, especially since the closure of Inland Hospital.
We've really established a meaningful relationship with these patients, and for that to end, that would be a huge detriment to those folks that have begun to rely on us.
Flannery and Frost hope that incentive to have these programs would lead to more EMS departments creating them, particularly in rural areas. The bill would also address reimbursement for calls that don't require a trip to the emergency room. Authorities say right now they receive just a $95 payment for MaineCare.
Every time we send an ambulance out, you know, it's hundreds and hundreds of dollars to respond in an emergency vehicle with medications, with people staffing it. We don't come anywhere close to recouping those costs.
Opponents includes the Maine Association of Health Plans and Anthem Blue Cross and Blue Shield. They say the third part of the bill, reimbursement for transportation to locations other than the emergency department, is too broad.
Maine's private health plans already do provide coverage for home health care, basic life and advanced life support services.
And it could inadvertently become a means of transportation to non-emergent medical appointments. Can't get a ride to the doctor's office, call 911, and the ambulance must take you and we must pay for it.
The bill now moves to a work session in committee. Keenan Mills, WABI News, Augusta.